So joining me are Dr. Maridee Shogren, who is the Dean of the College of Nursing and Professional Disciplines. Maridee, welcome.
Thank you.
And Dr. Josh Wynne, who is the Vice President for Health Affairs and the Dean of your School of Medicine and Health Sciences. Josh, welcome.
Thanks very much, Andy.
And we'd like to talk about a new goal or opportunity that we have in front of us for the university. And it's a growth of our health professions facilities. And so could you say a little bit about this project? Josh, we'll start with you.
Sure, thanks very much. Well, I think you started with the right word, which is growth. It's really important to find some new space so that, for instance, we can grow the nursing program. When we moved from now Columbia Hall, into the School of Medicine and Health Sciences, we were able to increase our class size overall by 25%. That provides more of the healthcare workforce for the community of North Dakota. Similarly, our research activity has grown, and we need more space. So that is the first important reason. The second one is to enhance collaboration. We are committed to interprofessional healthcare, and we think it can impact the care that patients get. Not only the care, but the cost. The United States spends $5 trillion on health care in the course of a year, and we need to reduce the rate of growth of that. One of the ways of doing it is by more collaboration, which reduces waste in the system. And the third is to reduce deferred maintenance costs. If we can take offline old buildings, we can save that money to use it for better purposes than keeping old buildings afloat.
That's great, great purposes. Maridee, anything to add?
Sure, I think what I would just add to that is our college is a perfect example of having 3 disciplines: nursing, social work, nutrition, dietetics, and we're spread over 3 buildings. So the opportunity to move closer and co-locate all of our professions is very exciting.
Awesome. So we're going to continue the game theme. So on the board, we will see something that looks like the $100,000 pyramid. There it is. And I will read a word, and then I'll get your reactions to those words. And Maridee, will start with you. The word is interprofessional.
And interprofessional, it is the perfect word to start this game with. So interprofessional in its most basic sense simply means that we are bringing multiple professions together. And at UND, we house the most health professions in North Dakota, which means that it gives us a perfect opportunity to bring our students together, not only in classes, but things like simulation and service learning opportunities. But it also points to us to using more interprofessional education, which Dr. Wynne mentioned. But the first step in interprofessional education is introducing our students to each other's roles. So when we can increase our understanding about what each of us does, it brings value to our roles, and it helps us to create a new kind of healthcare in this state, and it informs and broadens our healthcare leadership and our teamwork.
Awesome. The second word on the list is the word serve. Josh, over to you.
There we go. So serve. So first of all, service is the last letter in the UND strategic plan. UND leads. And as a public university, we get substantial support from the people of North Dakota. For the School of Medicine and Health Sciences, just about 1/3 of our revenue comes from the state. So we believe, and I think the university believes, that we need to return value to the state. The way we try to do it in the health professions is most importantly through healthcare workforce development. And we collectively have been able to increase the number of healthcare providers in the state, thus serving the needs of the state and its people.
Awesome. The next word, collaboration. Maridee, over to you.
You bet. Dr. Wynne already touched on this one a little bit, but collaboration is such an important word that we cannot say it enough. All of our professions need to work together to improve the health of North Dakota. At UND, we're committed to modeling this type of collaboration and how we collaborate with each other, as well as all of you out there as our community partners, and we're committed to teaching our students how to solve complex healthcare problems together. Every student, every person, and every one of you out there has a role to play in collaborating to improve the health of our state.
All right, thanks, Maridee. The next word, Josh, over to you. Rural.
So North Dakota, as we all know, has a significant rural population. And what we are focused on is really trying to improve the availability of healthcare, improve healthcare delivery, especially in rural communities. So first of all, you have to know what's going on in those communities, and especially for our Center for Rural Health, they touch the people in every one of the 53 counties in North Dakota. Similarly, we really are focused on providing more healthcare providers in rural areas, but doing more than that. We want to not just have the patient come to the healthcare facility, but figure out better ways to bring healthcare delivery to the rural communities, whether it's through the use of wearable devices or video conferencing. We want to try to improve the healthcare in the rural communities.
Great, thanks, Josh. Maridee, back to you. The next word is growth.
Awesome. Can I add one thing to rural?
You may. Rural, back to rural.
Yeah, just one thing. I grew up rural, and I'd be remiss if I didn't tell you all that I'm a very proud farmer's daughter, and there are good people in those rural communities. And I practiced rural, and everything Dr. Wynne said, I agree with. We've got to increase access to our rural communities. They deserve really good health care.
Awesome.
And with that, I will go to growth, absolutely. So growth means many things, but I think the first thing that comes to mind is growing our healthcare workforce. And did you know that even our state health improvement plan calls on us to grow? Its exact words are to expand access and connections. And it also asks us to strengthen our workforce and further our collective commitment to improve North Dakota's health. Dr. Wynne and I are very, very fortunate. We get to work with some of the best faculty and staff that you will find in North Dakota, and we are all committed to growing confident, knowledgeable, and practice-ready professionals who are going to serve our state.
Awesome. And then the final word on the pyramid is we've heard it before already today, discover. Josh, over to you for the final word.
There we go. So discovery is critically important in healthcare because the more we can learn, the more we can deliver better care to patients. I'll give you an example. As a cardiologist, we all know the dangers of high cholesterol, right? Well, if you're careful in your diet, you can bring your cholesterol down by maybe 5 or 10%. But through the discovery of medications that can block the development of cholesterol in the body, by giving you a simple 1 pill a day, we can lower cholesterol by half. That was not known a few decades ago. We now know it, and those medications are available for everyone. The way we improve healthcare is through learning new knowledge so that we can take that knowledge and deliver better care to all of you.
And both our College of Nursing and Professional Disciplines and our School of Medicine and Health Sciences are pushing the frontiers of science as well. So I'm so proud of the work that you're doing both in the classroom, in the laboratories, and supporting the state of North Dakota. How about a round of applause for Maridee Shogren and Josh Wynne? Thank you both for being here.